You will see on the screen a series of some slides, and I will go through them systematically. Purpose of this evening, of course, I wanted better attendance. I've tried advertising in a whole different ways of trying to get more people here. I don't know what to conclude from the lack of attendance this evening in terms of the public's interest in the issue.
Was it in the local press?
It was tweeted. It was.
No,
Was it
the local press. Not
Was it in the local press?
Yes.
Yes. In the local press. It was tweeted. It was all over the place. I mean, we do our very best to communicate all the public meetings that I hold. This is not the only public meeting that I'm holding in the next 7 days. The next public meeting is being through the press and it's been disseminated by a whole variety of different sources, and people still don't come. And so I do my best. This is the second meeting that I've had in the constituency. It is the 5th meeting in total. Was it the 6th? 5th or 6th meeting in the region that I've held. The best attended meeting was in Marlow, and we had pretty good attendance in Slough, and surprisingly not such good attendance in High Wycombe, and pretty good attendance in Lebanon. So I've sort of gone around the region because the whole purpose of this proposal is that it is a regional solution, because you cannot have a hospital to serve just Bracknell, you cannot have a hospital to serve just Wycombe, or just Windsor, or just Slough. The days of having hospitals serving just towns have gone. Indeed, they passed some time ago, and unfortunately, mainly because I think of a lack of engagement by politicians and by healthcare professionals, the public have somewhat been misled in terms of what type of hospitals are in their best interests. And so when I was, actually prior to my selection here in Bracknell, I made it clear in radio interviews and in any interviews where I was asked about Heatherwood that I was not in favour of the perpetuation of the status quo in hospitals in this region, that I thought that it was in the best interests of all that we consolidate acute and emergency services onto a location that serves the greatest number of people, in order to have a proper functioning 21st century hospital. And by hospital I mean one with a casualty, one with all the appropriate surgical specialities, one with all the appropriate equipment, in order to be able to have that type of service to provide care to this constituency. You have to serve around about 650,000 people. There are 110,000 people living in Bracknell Forest. So do the maths. You basically need 5 times the size of Bracknell Forest in order to have a hospital. In effect, it means you need about 9 constituencies per hospital. The problem is, and I obviously understand this because I'm in politics, most MPs want a hospital to serve their constituency alone. Well, they can all hope for that and try to promise that, but they can't deliver it. Not going to be delivered. And anybody who tells you otherwise is lying and or ignorant. It's not how medicine works. Medicine, the application of medicine, the provision of medicine involves quite skilled, highly specialised equipment and individuals together who require a large number of patients to be passing through their departments in order to justify that equipment, skills, and to maintain that equipment and skills. You cannot do that from every district general hospital the country has. We now have just around about 200 acute hospitals in Britain. We probably need about 100 acute hospitals. In order to go down to 100, those hospitals have to be in accessible locations. Those locations obviously cannot be opposite Ascot Racecourse or in the middle of a farm field north of Slough because the farmer's daughter was looked after at Upton Hospital, or indeed outside of Aylesbury because the Canadian Army built it there so the Nazis didn't bomb it. These locations are clearly stupid in the 21st century for the provision of the very best care which everybody would want to receive. So therefore, you have to conclude that the majority of locations, I would suspect, in the country, but even if it is 50%, 50%, you need to build new hospitals and close others. So there has to be hospital closures and consolidation. This is inevitable. This is what's happening already. In this region, we have a legacy that's extremely challenging. It has long been the case that we haven't got the right hospitals to provide the right care. It's not new. Anybody who's been in the profession, anybody who's worked as a doctor in this region has known this for a number of years. And there's a series of sort of vested interests as to why that is. But we are where we are. So I thought I had a responsibility, because I'm in a unique position of being a practicing doctor who served over 50,000 patients in a region in which he is also a constituency MP. I'm unique. There isn't anybody like me in the entire country, which might explain why I'm the only MP who's put forward a plan which involves closing hospitals and consolidating them, because it's counterintuitive for an MP to be suggesting that you would close a hospital. But in doing this, what you have to bear in mind is that I have the best interests of everybody, not just in this room, but in the wider community. Because if you do this, and you consolidate all of your acute emergency services onto a single site, and you then put all of the chronic care services into the community, such as Brad's Bridge in Bracknell, such as the King Edward VII in Windsor, such as Wickham Hospital, such as Upton Hospital in Slough. So you retain those sites providing chronic care, but for the acute emergency, for the heart attack, the stroke, the road traffic accident, the clever surgery, the oncology, which is the cancer treatment, all of these things have to take place in a hub hospital. Now, when I was starting, the challenge was, well, where do you put it? And this is where there is an obvious weakness in my plan. Because if you were to do this properly as a country, you would look at the map of England and Wales, because NHS Scotland is separate. So you look at the map of England, you say, well, where is the population density? Where are people living? What are the demographics? Where are the old people? Where are the young people? Where are the motorways? And you'd start probably from Dover, and you'd work upwards, and you'd say, right, we need a hospital there, we need a hospital there, we need a hospital there. You'd actually have a central, almost Soviet-like plan. Now clearly, I don't have the resources to do that. In fact, we struggle to do even this, the resources I have at my disposal in my office. But we had to decide on a location, choose a particular population and go, right, that's how we're going to do it. But we recognised, and we always recognised, that there was a danger of overlap with other hospitals and which hospitals should be merged and all sorts of stuff. There was always going to be that flaw, but you had to start somewhere. So having decided that there was a particular population group, I chose the location. Now the obvious political thing to do is to have shoved it in Bracknell. You know, Bracknell MP goes to Bracknell Hospital. And everybody would have laughed at me. Okay? Anybody in the profession would have gone, no, anybody understood the subject, sir, and understood the local health economy would have gone, this is incredible. He's done this for purely political reasons. Right? So I had to think about, well, where would I put a hospital to serve the community that needed serving? Well, it had to be on the M4. I mean, there was only one major road passing through the area. It had to be on the M4. And then, having made that decision, I thought, well, the major communities, the big hospitals, big areas were Slough and Windsor. So, did I go with a merger with the Royal Berks type sort of scenario and Frimley, or did I go with South Bucks? Now, looking at the two gentlemen here who are from South Bucks, I think I might have made a mistake of saying Bucks, actually, because the whole Bucks system is separate, and there's a whole reason in historic history about that. But I went with Junction 89 because of the fact that it was at the bottom of a bypass in High Wycombe, who are struggling with their healthcare services, to say the least, and it was on the M4. I didn't at the time know that there was any land available. There wasn't a specific piece of land that I was aware of. There since has become a situation that there is actually an ideal piece of land that's the ideal size at that junction. Since I announced this, it turns out that Frimley is absorbing Heatherwood and Wexham. There's going to be some sort of merger. I'm also hearing of the possibilities of some financial issues with Royal Berkshire. It's all I'm hearing, it's rumour. Now clearly if the three of them were to merge, which I don't know if is going to happen, I can't say publicly that it is, it's pretty obvious that a sort of an epicentre of those three trusts is not too far from where we're standing. The point I'm trying to make is that I'm pretty agnostic. I don't really care whether it's Junction 10, Junction 8, 9, or whatever it is. What I know is that we need a consolidated acute emergency hospital to serve the community of East Berkshire and South Berks. Fact. We know we need it. We don't have the necessary facilities in place as we speak. We try to make do and mend on every hospital site in a desperate attempt to try and provide the best services. And they're all working extremely hard to do so. All the doctors and nurses do a wonderful job. All of that's true. But they're doing it despite the buildings in which they're having to exist. And anybody who goes to the Royal Berks will say, possible to park, difficult location, a series of buildings all bolted on. The same as at Wexham Park. You go to Wexham Park, there's cars parked all over the place outside. It's pretty difficult at Wickham. Everywhere you go, the locations aren't very good. So it all pointed towards a location where everyone could get to, where we're better than on a motorway where there are 6 lanes, i.e. a greater flow of traffic. And I chose Junction 8-9. I still think Junction 8-9 as a location has a lot of merit because there is a piece of land there that would be considered for such a development. It's the right size, it's the right acreage, the owners want to sell it, etc., etc. But, I'm not going to, throw my toys out the pram if suddenly the location becomes somewhere else. And I've been misquoted on that and misinterpreted. I've never been wedded to one location, but I had to choose one around which to build a plan. Now you'll see it all sort of spins around, and you will see that the different sort of community hospitals that currently exist, as well as the acute hospitals. Now the only acute hospitals on that map that are what I would describe as acute hospitals with casualties, there's only 2. All right, the Royal Berkshire and Wexham Park. They're the only 2 hospitals which actually have services which I would equate to be what I would call a hospital. So if you don't mind, from now on I'm going to talk about hospitals, I mean acute emergency hospitals, and community clinics, i.e. places where you would have chronic care provided, but they're not hospitals in a sense that you'd go there if you'd had a car accident or a heart attack or a stroke. Because all the other places, with the possible exception of Wickham, where there's a sort of form of a stroke service, but it's sort of all shared with other sites. In fact, actually that stroke service is an example of how people are trying to make the best of a bad situation in terms of where the units are. That just is just a quick slide indicating the direction of travel in terms of demography. That's the population increase that's expected. And don't forget, in the area that I'm talking, don't forget to that you've got to add all the people who work in the Thames Valley. They're the residents of East Berkshire, South Berks. This is a projection on ageing, I think. Yes, that's right. Yeah. You will see, all you need to know about that, they're the sort of the council regions. Look what everything's doing. I mean, you have an ageing society, and that's a massive challenge across the board in many, many ways. But ultimately, in view of the fact that 65% of bed days are occupied by people over 65, if you're getting more and more people over 65, you've got a problem looming. Now, the financing of the project, when you look, I'm sure all of you have downloaded and read my report online, but we're not developers, and we've put the caveats in that this was a really difficult thing to try and to calculate. But there were certain assets that we were saying, right, we will sell this and sell this, and then we had to try and make some sort of guesstimate as to what those properties would be worth. We downsized sort of the certain hospital sites in different ways. I mean, the percentage sell-off. This is also guesstimate territory, But you will see, and we use like a sort of basic, what would a 2-bedroom flat be worth, etc., etc., etc. But in effect, what we were saying, the broad sweep sort of this rather complicated slide was that we were advocating the sale of Heatherwood Hospital completely, the sale of St Mark's Hospital completely, and we were taking out a percentage of Wickham Hospital and a percentage of, and we were selling Wexham Park Hospital completely, and we were taking out a percentage of Upton Hospital, which is quite a large site in downtown Slough, and we were using the money from those sales in order to fund the cost of the new hospital. These figures seem rather large, but actually, you know, this was on the basis of £250,000 approximately for flats. How many could you put on a hectare, etc., etc., etc. So even if you take the more modest figure, which is about 500 million, you can see that there's quite a lot of assets to release here in terms of sort of realising and to make some money. And even if it's half that, it's still a lot of money. So the total cost, this price of 500 million, this was arrived at essentially by comparing the size of hospital that we envisaged, which was around about 1,000 beds. And we looked around the country and we thought, right, what else has been built? How much does that cost? And we found quite a sort of significant range, actually, for prices. But the ballpark figure, a realistic figure, was around about 500 million quid, particularly in view of the fact that you're in the Thames Valley, southeast of England, land costs, construction costs are going to be more probably in the Midlands and the North. That was our judgment. So we upped the figure a bit, and it actually, and this was a coincidence because I remember doing it, it came out at around about what the lower end of the realising of the assets was. So in effect, one paid for the other. But even if it didn't, if you think about the fact that how much money is taken in tax in this part of the world, it doesn't strike me as particularly too much to ask for 100 to 200 million pounds for a hospital to serve 600,000 people for the next 50 years. It's peanuts, to be honest with you. It's not a lot of money. But I thought that the project pretty much wiped its face. You know, one paid for the other. But the additional thing, if you go to the slide before, I think which one was it? It was this one or look. No, this one. I go on to say total cost because the plan envisaged retaining a decent sort of community clinic in Slough, the same services in Windsor because it's a very tight site in Windsor, the same services in Henley, a smaller site but efficient site in Wickham, and an enhanced site in Bracknell, because Bracknell loses its Heatherwood site, but the actual Grants Bridge site, which incidentally Royal Berks can't really afford, which is why the second floor is empty, that site could be enhanced, and so that all that you could get additional services, additional chronic care services, additional services such as outpatients. So when people say to me, "Oh, I can't believe you're putting this forward. What if I have to go to my outpatient appointment? It's just blah, blah, blah." I said, "Well, hang on a minute. Have you read it?" Invariably, most people who've criticised what I've said haven't actually read my report. In my report, I make the point that the whole purpose of this is to increase the number of outpatient clinics that are being run in towns, in communities. So the elderly lady with diabetes, or the elderly lady who's got Parkinson's or whatever, who wants to see her consultant, doesn't travel to this big brand spanking new hospital. She travels to Grants Bridge, and the consultant comes out once a week on a rota to Bracknell, and does a clinic in Bracknell, does a clinic in Slough, does a clinic in Wickham, which incidentally is sort of how John Radcliffe works for some of his specialities. Hospital, the consultants move around. And so in effect, what I've advocated, and it hasn't been reported as such, is an improvement in the level of care and services in this constituency. An improvement, not a reduction, an improvement. Enhanced services in the constituency, because the hospital Heatherwood isn't in the constituency. So your MP has actually put out there a proposal to improve services in the constituency. And yet, not always been reported as such. And in addition to that, this proposal will improve acute and emergency services for the region. Not detract, not reduce, improve. Because these things, there's been some changes since these slides were made around stroke care in the region, and it's still evolving. I mean, Royal Berks has got a stroke unit. I'm not sure it's 24 hours, but
It used to be a battle, and it used to be one of the best stroke units in the country.
it wasn't a proper stroke unit back.
It was. My father-in-law was in there, and I was up there. For,
What do you understand as a proper stroke unit?
It was specialists coming down from Bracknell.
So I'm asking you, what do you understand to be a proper stroke unit?
Somewhere that someone that's had a stroke can be looked after and rehabilitated.
Which involves what?
Everything you need to be rehabilitated, which is what happened.
But actually, it's not the rehabilitation that's the key. It's important. The key is you're properly diagnosed as what's caused the stroke.
Yeah,
Have you had a bleed? Have you had an ischemic stroke? And you can only do that with an appropriate scanner, with the appropriate skills to interpret the scans,
That's right.
which didn't exist at Battle Hospital. We haven't had a proper stroke unit in the region. 24 hours, bells and whistles. There have been some improvements recently in an attempt to respond to some pretty dreadful statistics around stroke care and stroke outcomes in this country. In London, they consolidated stroke services years ago. It's now saving over 400 lives a year. 400. If they did the same thing across the country, which is what my plan is advocating, in effect, consolidation of services, we'd be saving about 2,500 lives a year. I want to be on the side of saving 2,500 lives. That's where I want to be. And I actually want people in my constituency to survive stroke, not to not survive stroke. And you survive stroke by having the appropriate unit, appropriate skills, and the appropriate facilities.